Thank you very much for the conference organizer and Dr. Dong Zhilin giving me this opportunity to share my personal experience for all the world expert. I'm here to study, to learn from everyone. By today my topic I would like to talk about for years I've been promoting for qi arrival technique. The most significant qi arrival it's muscle jump. So that's we call the jumping qi technique. uh, Jumping qi technique because what's the qi arrival, or we call the arrival of the qi. Really, it's not only needly sensation, because when the qi arrived, patient do feel some sensation, needly sensation. But when the patient feel needly sensation, doesn't mean you get the qi arrival. The arrival of the qi really it's the indication of your needle really touch the meridian. By the sensation, any place, any layer your needle reach, you should get the sensation like on the skin, muscle, and the martial, the masha, fascia, bone marrow, tendon, blood vessel, everywhere you do get some kind of sensation. So that's we call when you get arrival of the qi, you get the sensation, but you only get the sensation doesn't mean you really get the arrival of the qi. It's like the sheep has four legs, but you can't say every four legs it's the sheep. So that's a different. But of course, we have a lot of articles supporting this, particularly from ancient time. All the expert, really describe the arrival of the qi always in associated with the muscle jump, such as the 1978 Nan say the arrival of the qi looks like artery, not artery, but it looks like artery. It's movement by irregular movement. But Biao Yu poetry mentioned that when you get the arrival of the qi, it's like a fishing. You caught a fish. When you caught a fish, you definitely feel activity because the fish is still alive. The movement causes the water bubbling. So it's the same thing, just use different word. Only by the description of the sensation, it's not enough. But the acupuncture really, it's the medicine. Medicine is really wanting to resolve the problem, not only the theoretically to discuss some concept. And then people will ask me, what's the difference will going to be make if you get a jumping qi, or I only got a needly sensation? Is there any difference clinical wise? Today we were going to discuss that, since the difference is so huge, so significant. Um, for the headache, patient get a headache. It's not easy to treat. Some people suffer for 30 years to see the pain doctor, pain management physician for 30 years, still suffers. Patient, depend on the painkiller, for so many years and hardly be able to, because when you take any medicine that help the headache, but does not help treating what the cause of the headache, only just let you feel less painful when you get a headache, never treating get rid of the headache. The medicine to help the headache can give a patient headache. So it's not easy to treat, but if we only use GB21, we get a jumping qi and then connect with the electrical stimulator. Most of the time in my experience, I treat maybe 40, 50, close to 100, a variety kind of the headache. Sometimes the migraine headache, cluster headache, right before the menstruation. Some people just stressful tension headache, all kind of headache. Most of the time, doesn't matter what kind of the headache, with one or two sessions, patient feels significantly improved. Before I use this technique, I'm traditional practitioner. I treat so many points, the head everywhere. The patient get better, but it's not enough. I never have succeeded with one or two sessions get rid of the head. But sometimes patient without the treatment, the headache will stop the next day. That's a different story. We talk about the patient very regularly, constantly severe headache. So GP21, you get a jumping qi. Most of the time in one session, patient feel significant improvement. Sometimes maybe second time, third time, depend. First time, maybe you didn't do right. You got the qi, you lost it, or whatever the reason. Or you get the qi while patient retain the needle, the patient moved somehow, the sensation stop. I mean, the needle alter the qi, the meridian, so that's the results, it's less. And even, particularly even for the migraine headache, sometimes patient, severe migraine headache lose days. You have to lock yourself in the dark room, no noise, no lights, because everything can irritate you, triggers for the headache. It's very severe by this taken care of. And also for dizziness, vertigo. Dizziness, vertigo, also it's not easy to treat, sometimes due to inner ear, sometimes due to something else. Again, GB21 just with just only 1 point, 2 needles, and get the jumping qi connect with the electrical device. The patient again, it receive a significant improvement with 1 or 2 sessions. And also the difference is when you get this jumping qi, patient get the results will carry on. And the results will be with the patient. Sometimes we do something, the patient gets some relief by 20 minutes, 2 hours, they come right back. So that's always the case. But when you get the jumping qi, it doesn't happen. The patient get results, the results carry on for days, sometimes close to the permanent. And also unclear mind, some patients just feel the head, it's unclear. And again, this point helps, very significant neck pain and the shoulder muscle pain and sometimes the stiffness of the neck. We call laozhen. It's sometimes pains for days. With 1 session, the patient get better. And sometimes instantly, patient get much better. And sometimes for common cold, where the patient gets sick, get ear congestion, where the patient just feel, could be from sickness, feel fatigue. All those conditions, we treat the GP21, only 1 point, get a jumping qi connect with the electrical device that take care of the symptoms very instantly, and the results it's carry on. If you try 1 time, you will know, because it's not only I produce those kind of results, my students, they do the same way, they get exactly the same results what I do. So that's the first sector. And the second sector we talked about, we treated the triceps, tricep in the shoulder, tricep, any 2 point on the tricep, we gotta go to jumping qi. Very easy to get the jumping qi on the tricep. And then we connect with the electrical device that help the opposite side of the sciatica pain, lower back pain, hip pain, knee pain, terrific. In the past, before I used this method, I treated back pain. Some patients responded good, some patients don't respond well. Young people, skinny people, they respond much better if we treat locally. But elderly people, the patient overweight, the patient hardly ever get better. If the patient get better, the results are, very, very short lasting. And because of the people elderly or overweight, it's very hard to locally get a good jumping qi. But in the shoulder, very easy. No matter how big size the patient are, you can on the shoulder, you can get the qi very easily. I often use 2 connection. The patient most of the time feel better, instantly, because in the class, I, teach in the class to do the demonstration. Most of the time, some students say, oh, I have a back pain for a long time chronically, always instant relief. As the time going on, results get even more. Let's say in the beginning of the class, I did patient feel, oh, I feel 50% better. By the class continue going on, next hour or 2 hours, the patient said, oh no, I'm 70% better. So after treatment, later on the day or next day, the patient get most relief. And the results carry on. It's totally different than you not get this jumping qi. Sometimes patient get relief, but comes right back, and sometimes even worse. But I also treat locally, local shoulder pain, arm pain, neck pain. And for the shoulder joint, sometimes the joint is locked, you can't move, you have a limited range of motion, like a frozen shoulder or something, 50 shoulder, or what we call, we use one tricep, another one GB21, and connect it with an electrical device, that works beautifully. Again, one session, patient feel, as long as you really did it right, patient feels significant relief. Because the shoulder pain used to, I have to use large intestine 14 or get into the joint to treat. But no, I don't need to do this anymore. But results are much more profound, especially for the sciatica pain. Treating those conditions now, for me, it's a relax. It used to be I just do everything to leave the needle for 24 hours. I just try everything, herbs and marks, and nothing worked. This works beautiful. I don't have to do anything. Only two needles. That's it. Take me 10 seconds to do the job. And the results, it's much more than anything I do. And then large intestine 4, if we get a jumping qi, also connect with the electrical stimulant, help the sinusitis, common cold, fever, particularly for the nasal congestion. So nasal congestion we treat a lot of, large intestine 20, B-tone, around the nose, we stick a lot of needles and sometimes try to get a bleeding. Sometimes use UB10 or warming technique, sensation going up to the sinus. So none of this works as good as a large intestine 4. So simple, just laying there, 2 needles, connect with the device, but have to get a jumping qi. Without a jumping qi, you connect electrical device that still jump, never work. So most of the time during the session, the patient sinus opens up. Some people have a fever or the patient sick, feel very uncomfortable. Fever, congestion, body aches, chills. LI4 connection, in 10 minutes to 20 minutes, the patient feel normal or close to normal, the energy arising up. This included for influenza, included, COVID-19. COVID-19, I don't treat it that many because my clinic, people get scared, don't want patient, we only use herbs. By same treatment as the flu, virus, LA4 will take care of, but you get a jumping qi connect device. And also for the hand pain, swollen hand, arthritis. Arthritis is extremely difficult to treat. For the conventional medicine, sometimes use the drugs. Patient suffers for, and they never get better. And, 20 years, 30 years later, get worse, and get much better. Sometimes get temporary pain relief, but with arthritis, with, jumping qi technique, connect with the device, 1 or 2 sessions, the activity phrase will turn it into the, dormant phrase. The swollen, aching, painful joint will disappear. Just with 1 or 2 sessions. But of course, arthritis, when the patient, the joint get deformed, it will not going to bring it back. They will stay. By what we can do to prevent the joint to get more deformation, and also we can take care of the, bring it to the activity phrase into the dormant phrase. That's what we can do. But we have to be honest, the deformation of the joints is not going to change because that's the bone structure. But the soft tissue inflammation, we take care of with 1 or 2 sessions. And another one, it's a very, phenomenon. I treat a splint 10. Splint 10 jumping qi with a connected electrical device. This splint 10, as according to this point, it does not really help for the infertility or urinary tract or fertility or loose system. It's not. But get a jumping chip connected to the electrical device, electricity go up, will circulate right across the external genital region or urinary tract. So that's why it works beautifully. When I treat a patient with difficulty urination, or sometimes the urine leaking, or sometimes it's unable to empty the bladder, those kind of issues with the splint 10 jumping chip with the electrical device. Most of patient responding in one session. One session, I treated at least 20, 30 of patients of those kind of condition. Everyone responding one session. Some hardly ever need a 2-second session. Sometimes, when I do this, I have a very confidence. I don't ask, how do you feel? Do you feel better? Even the patient tell you I feel better, could be only for 30 minutes. So I don't ask. I know patient get better. I don't need to ask. So next time the patient come back, when I ask the patient, most of the patients say, oh yes, I do feel better. Even though maybe not 100%, but I do feel much better. But occasionally some patients say, I feel similar. I feel the same. But I know the patient say that word. It's the patient feel better, but patient not sure really get better because in the patient's 20 years, 10 years experience, there's some days feel not quite as bad as the other day. So the patient don't know whether your treatment help or just in time this day I supposed to feel not quite as bad as 2 days ago. So, and the second time when the patient come back, they always, noticed, oh yes, I do feel better. I do feel better. Just 1 or 2 sessions. And so also for infertility. In Chinese medicine, we say sometimes a pregnant woman, for pregnant woman have a breech stage, the UB67 supposedly help for change the position of the feeders. But in the clinic, I treated this, hardly ever work. It's not very effective. By splint 10, sometimes with cooling technique or splint 10 connect with the electric device, always works 10 times better than the UB67. Also for the menstrual cramp, included, irregular period, menstrual period, or the patient has endometriosis, those, etc. A splint 10 connected with the electrical device always take care of very quickly. After a few sessions, the patient will have a much easier menstruation. And also, the patient pregnant by past due, sometime past the due date, the gynecologist does not want to see the patient past due date and still not be able to give up birth because the baby is growing. It's and they would like to use some drugs to help. But sometimes patients don't want. They come to here for the acupuncture to help. Splinting with the cooling technique, the best. Sometimes patient feel too sensitive and you can't do the technique, just connect with the device. Works less, but still working beautifully. The patient will start to give a birth very soon. So, and that's for women. For male, prostatitis, enlarged prostate, it works beautifully. Last time, a few days, a couple of weeks ago, I shared with one patient, female patient had a difficulty to urinate. She used a caster, and she casterized every day, not 8 to 9 times, sometimes more than 10 times a day. And for 10 years, never urinated 1 drop on her own. So it's very, really painful experience. So she's always get the infection, UTI. So I treat her after second time. After treatment, the second treatment, she go to bathroom, she urinate a little bit, not fully or 100%, but partially. She was very excited. That's only second time. So that's 10 years first time. And then after 5 or 6 sessions, she only need to use 2-3 times castorization instead of 8 to 9 times. So now after 10 sessions, she doesn't need a caster. catheterized anymore. For insurance purpose, for sure, she use maybe once a day, maybe every 2-3 days. The reason she uses it's not she really needed it, but she has some fear. She say, if I cannot empty the blood completely, when the urine piled up, going up, they will hurt the kidney function. That's the only fear. But actually she be able to urinate. So on those kind of sensation, you can't say because I give a patient confidence, I let the patient relax, or the patient 心理暗示, that's not going to help because it's a physical symptoms. You have to use catheterize. You have to use catheterize, no matter how it holds your mental state, because it's a physical condition. And plus any tissue you don't use for 10 years, you lose it, even the muscle or legs or knee. But a few sessions, she recovers. So without get a jumping qi, I guarantee you, you will never get this kind of results. And also another condition, it's very significant. It's we call the restless leg syndrome. Restless leg syndrome, acupuncture works, but you treat for 3-4 months later, the patient will still have the symptoms. Will not going to be cured in a short time, because this patient can suffer for 20-30 years or even longer. Very uncomfortable. It's not a pain. Pain, it's not helping. Sometimes patient use Neurontin or Capra. This kind of for the nervous system, that can, it doesn't help, especially Neurontin doesn't help, because it's not the pain. Painkiller is not going to help. With acupuncture treatment, any point on the leg, 2 points, get a jumping qi connect to the electrical device. The patient responded. Most of the time, I treated this condition, maybe 20, 30, 40, 50 patients, 1 session cured. Never have this problem again. Occasionally, maybe need a 2nd time or 3rd time. And then after 2-3 times, or even 1 time, the patient never complain of restless leg ache. But sometimes patient say something else. Oh, I don't, I feel tired, or sometimes I have arthritis, or I have some other issue been treated, but never the restless leg. And for the last one, jumping qi, if you get a jumping qi, you perform the setting the mountain on fire or penetrating heaven coolness. You can get the temperature increase or decrease more than 4 degrees Celsius. But without jumping qi, you will never be able to get the temperature, local temperature arrive or decrease, increase or decrease more than 1 degree. But with the jumping qi, you can very easily to get more than 4 degrees. So that's significant. That's why we say arrival of the qi, it's the most significant key point for the acupuncture practice. Ancient acupuncture all refer that. But now we say that needle sensation, that's useless. But of course, acupuncture has 2 systems. One is to treat the meridian system. The jumping qi indicated that your needle really reached the meridian. Another system is treating the 5 elements. 5 tissues. 5 tissues, you don't need a jumping qi. When the patient get a blister on the bottom of the feet due to long walking, you don't need has nothing to do with the meridian. You just break the blister, release the water, patient heal. Sometimes has something else on the skin, you burn out. It has nothing to do with the meridian. But that's why we have 2 systems. When you treat a 5 tissue, no qi, it's okay. But when you treat a traditional point, arrival of the qi, it's most important. Sometimes we mess up. When we treat the meridian, we talk about treat the 5 tissues. When we treat the 5 tissues, we talk about, it's mess up, complicated. But we have to separate, very clarify. So that's the most important. That's what I have to say today. I appreciate everyone participated in this. But of course, if anyone has any questions, we can always discuss. So that's all. Thank you very much for everyone. Thank you again to giving me the opportunity to share this experience with everyone. I just hope people learn this idea to try out and use it in the clinic. They will save you lots of headache. Thank you. Thank you again.